So my name is Emily Devine. I'm with Stoughton Health Physical Therapy. I work here in the Stoughton Clinic and outpatient orthopedics and sports medicine. I've been with them for a little over 15 years, seeing a variety of injuries and surgeries and all that stuff. I am a Badger at heart. I went to UW-Madison for my undergraduate, which I have a degree in molecular biology, and then I have my doctorate in physical therapy from the Medical University of South Carolina in Charleston, South Carolina. So I am a Wisconsinite though. This is my home. So lived down south for a while, too hot, came back, right? So just a couple things. We're going to go through our program today. The intention is to feel like you can get up and try things, including everyone at home. So for those of you that are watching at home, I'd encourage you to maybe go somewhere where you have a table or a chair nearby so you can use it for balance help if you need it. And then, of course, here in class, you guys can just stand up and use or move around the room. We're going to talk a little bit about different injuries that are really common based on research on pickleball. I'm sure if we could have everyone that's watching raise their hand, somebody would probably raise their hand that they've had some sort of owie with pickleball play, right? And so I know there's going to be a lot of individual stories and synopses of what's hurting you. And so at the end, we'll offer some time for questions. And if you are on watching online, you can actually put a question in the chat and Kelly will help facilitate that at the end of the session. I will say if it's more individual to you, that might be a great opportunity to come and see us in clinic. So let's go ahead and get started. Okay. So here's my details. Everybody should have that. Those of you at home, if you haven't checked your email recently, you should have a copy of the slides as well. So you can follow along. So you don't have to feel like you have to jot notes all over the place at home. You can watch along here and see them on your email. This has my email address, my personal email address. If you have any particular questions that come up after today's talk, please message me. If you don't hear from me, sometimes there's filtering on our system for getting emails. Just give me a buzz, give me a call, and I'll get back to you. Okay. So the talk, physical therapy, serve up pickleball injury prevention. Isn't that fun, right? All right. So learning objectives today. We're going to talk a little bit about pickleball's rise to the top. Okay. We're going to go through some of the different injuries that are probably the most common injuries that people get with pickleball. Not to say we're going to miss some. I know that we're going to miss some. Okay. But we'll talk about the most common. We're going to talk about injury prevention. And then we're going to exercise a little bit. And that's why I was saying, let's get up and move and try and feel how your body moves with some of these things. So you can kind of get an idea. Some of the things I hope a lot of the people are already doing. But I already heard a couple of murmurs here. Oh, I'm not doing that enough. I'm not doing that enough. Just looking through our slides. So let's go through it. My hope is that you end today with a little bit of a better understanding of some really easy things that you can do to help prevent you from getting hurt. Okay. And a program that you can actually jump into to prevent you from getting hurt. Now, as a clinician, I hear a lot, well, I walk every day, I garden all the time, I do this or I do that, or I play pickleball, I don't need to exercise. And that's not true. Unfortunately, you need to do something outside of whatever activity you're into. And so even though you might play pickleball multiple times a week, that's not enough exercise. Okay. And so the exercises though that I developed for y'all today are based on where most of the injuries occur. Okay. So they're unique to where a lot of people hurt themselves. Is there more you could do? You bet. There's always more you can do. But these are just something that will help you get started a little bit to hopefully help you not get hurt. Okay. So, and then again, we'll save questions for the end. So what is pickleball? All right. It is probably the fastest growing sport in the United States. That's wild, right? 40% increase in between 2019 and 2022. This was started in the 60s. Yes, by I think it was a senator or a congressman in California who they didn't have the right equipment and they started playing a game and boom, they created an association. So it's been around forever, but I have never heard of it, right, until recently. And I think a huge jump of it kind of came out because of COVID, obviously, right? An outdoor sport that people could do together and still have some socialization. 75% of the people that do it are over the age of 55, okay? So the general thing with pickleball, this is a description mainly based on what some people say. You may think of it differently, but it's a cross between tennis, ping pong, and badminton. That's kind of the big idea. The difference is it's a smaller court, and the ball is different. If for those of you that have played, you know, that's a little bit different ball, kind of looks like a wiffle ball. It does not feel like a wiffle ball. You do an underhand serve. So with pickleball, because of the underhand serve, we don't see as many shoulder injuries because of that. Okay. And it's generally slower and less impact, except for those uber competitive players, right? So I think that's why we have a big draw to the sport. So let's jump into some of the injuries that we see. So the most common injuries are going to include these: a strain or a sprain. So a strain is going to be a tendon-based injury, where a sprain might be more like a ligamentous injury, okay? A fracture can happen, unfortunately, and contusions like bruising and things like that, okay? I've included these little stats because I thought it was interesting. Males are 3.5 times more likely than females to get a strain or a sprain, okay? And females are 3.5 times more likely than males to have a fracture. I think that's just based on probably, you know, osteopenia, osteoporosis, more common in our female population. Males, as your body gets older, your tissues change a little bit too, can get a little bit tighter, can get some of those. With females, 9 times more likely to be a wrist fracture. So if you're playing, you're back pedaling, boom, you fall back on your wrist, you break your wrist, okay? So those are probably the most common, but this is just a list. Probably, again, we're missing some, but what a list, right? Holy smokes, there's a lot. So ankle sprain, an inversion ankle sprain, you roll your ankle, okay? An Achilles strain, that's your muscle back here and your little tendon, or a rupture, that can happen too. We know the Achilles ruptures because we got Aaron Rodgers who tore his, right? So we were familiar with that term. Knee pain, plantar fascia pain, the bottom of your foot, your arch hurts. That's what plantar fascia is. Straining of various muscle groups. So hamstring is the back of your thigh. Quadriceps is the front of your thigh. Adductors is your groin or your inner thigh, okay? Or your hip flexors, which are right up on top, okay? Wrist pain, that can happen, or what's called an epicondylitis. That's inflammation where the muscles attach in your elbows. So all the arm work, okay? And then back, just general back strain if you overdo something. And then again, we've talked about the fracture usually occurring from a fall. So huge variety of different injuries that can occur, okay? So why, right? Why are these injuries happening? Probably a really big one is shoe wear. We'll talk more specifically about that, but poor shoe wear. You're tight in your calf, so you go to move and you pull your calf or strain your Achilles, okay? There's a lot of those of you that play, there's a lot of side to side movement, right? Quick side to side movement. And if you have a lot of weakness through your hips, you can injure yourself, okay? Also, if you're just generally tight, you just kind of get out of the car, you walk to the court and boom, 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 you're playing. You haven't done anything to warm up your body. So you can be a little bit, just tight muscles can lead to more injury or strain. Poor grip on your racket. If your grip on your racket isn't the right, maybe your racket's not the right size for you, or your grip is a little bit too big or too small, that can end up with some overuse injuries where we're going to see those elbow pains or wrist pains. And then again, circling back, no warm up. Okay, so no warm up. All right, so let's talk about how do you guys stay off the bench? Okay. So the idea of this is just to talk about different things that I want you to go home and look at with regards to shoe wear, and also try to start getting integrated into your daily routine for play. All right. So the first one, shoe wear. So improper shoe wear, remember, is one way that people can hurt themselves. So if you go and do the Googling, all right, you're going to say, what's the best shoe for pickleball? And you're going to get about 18,000 different shoes. Okay. So these are kind of very broad. I think that shoe is like a K-Swiss or something. Okay. But the things about the shoe is what matters. So you need to have a wider toe box and an arch support. So wider toe box means, mine are not, these are running sneakers, but that means like where you would hold your toes, that needs to be a little bit wider. Okay. So not so narrow like a running sneaker. You have to have some sort of arch support. So you can't go out and just play in flip-flops. Okay. And things like that. You need to have support under the foot. So it makes you feel connected to the court. Okay. And that's what we call is that mid-foot shank. Okay. That's for added stability and unwanted twisting. So remember we talked about how with pickleball, there's a lot of quick, rapid side to side movements. You need to have good connection through your shoe and a nice stable shoe so we don't roll the ankle, and you can really feel where your foot is on the court. Okay, so a shank is the inside of your shoe. So right down the middle of the shoe, that's your shank support. Okay, and that's what really helps connect your foot to the court, really makes you feel what you can feel. So it's going to help you. Great shoe if you're like a little bit concerned about balance, so like just for going out for a walk or even just walking in the uneven surfaces. You need a nice shank. Okay, the other thing that's recommended is what's good traction, and they say a herringbone pattern. So you guys know what herringbone is, kind of that zigzaggy pattern. Okay, so not like a running shoe. Running shoe like mine is all over the place, right? But you need that herringbone pattern is just good for getting better traction on the court. So shoe wear is something that if you're just getting started and you're not so sure, you're wearing the same shoes that you wear to the gym, to the pickleball court, to the grocery store, guess what? It's time to get some new shoes if you want to be an active pickleball player. Okay, and these are things you can look for. So you can go to some of the local stores in Madison or around the area and say, I'm playing, you know, most of them at this point probably have their staff up and ready for pickleball shoes and know what they're looking for, but you should be able to ask the staff and they can steer you in the right direction.
So kind of like just like a court shoe.
A court shoe,
is what
exactly
you-
is what it's called, like a tennis shoe, but not a sneaker, not a running sneaker. So wide toe box, a nice support, and a herringbone pattern is the key. But those shoes will make your foot feel flatter in a good way. Okay. Any questions more about the shoes? If anybody thinks of something we could talk about at the end, or come up on the chat. Yeah,
Do companies make pickleball shoes?
they do now. They claim they're as pickleballs. Yeah, pickleball shoes. So I pulled up that picture that's on that slide because I kind of said, well, I wonder what they're saying is the best. And there's a bazillion different types of shoes. So I was like, when I looked at like kind of the all around best shoe, you can like base it on, hey, I'm more of a, you know, active player versus I'm more of a casual player. I think they would recommend different levels of shoes, and some of them can be pricey, you know. So I think the K-Swiss, if I'm remembering why I put that up there, is that was kind of like the all around best brand shoe that you could do for a pickleball court, but by no means does that mean there's not others that are just as good. Okay, great question. All right, now we just talked about all these terrible things that can happen with pickleball, right? All the different injuries, the strains, sprains, fractures, the bruises, all that kind of stuff. The one thing that was on that list is that people are tight when they go into play. They could jump out of the car after running errands and meet their friends on the court, and they go and they just jump right into it. And the big thing is they're not warmed up properly. Okay, so now what we're going to show you is what's called a dynamic stretch. Okay, or dynamic stretching essentially is something you do before activity or before play. It's different than like a static stretch. All right. Dynamic stretch mimics the movement that you're about to do. So it's warming your body up in a kind of controlled way to get your body ready to play whatever activity you're getting into. Okay. So what we have here is, skip one. Oh, I can't back up. Can you back me up? Oh, it's working now. Never mind. It wasn't working. So sorry about that, you guys. So again, it mimics movement. This is before you play. It's probably going to take you like 5 to 10 minutes. So kind of plan ahead for that. You know, I actually think if you guys get comfortable with the program and you go to the courts and you say with your friends, hey, can we do it? I bet they'd all do it. They just need a leader to get you started that knows what to do. Okay. So about 5 to 10 minutes for the warm-up exercises we're going to go over. And then also either a slow jog or a fast walk. And that's for the old heart ticker, the heart muscle, right? We can't forget about that one. And that could just be really fast walking, doing some laps each direction around the court or back and forth, or just a very light jog. Again, just to get your heart rate going a little bit. Okay. So dynamic stretch. So let's talk a little bit about them. So I included a variety of different stretches here. And again, I would say I'd like everyone to try to go along with it. So if you're at home, it's time to stand up. You guys, it's time to stand up. Gotta wake yourselves up, right? Come on, Taylor. If you're going to use the chair, just be cautious of the chairs here because they do move.
Oh, they
okay. So the first one is our arms and our shoulders. Again, it's not an overhead serving, right, with pickleball, but there can be shoulder injuries, or maybe you had a prior injury, okay? Basic circles. So you would just do some arm circles, just like in the picture, and you want to go each direction, okay? And then swinging, just swinging them back and forth. You should feel that through your shoulder blades. You should feel that through your chest. And I kind of think of like dynamic stretching as like you're just kind of bringing heat to the area, like blood to the area, just moving the muscles. So super easy, just get them things moving. So it's not super structured, like you got to be like 1, 2, 3, 4. Okay. Just get moving, just get them moving. Okay. The next one is great because this is really working like this part of us. Okay. So the picture, unfortunately, I only have 2, and it's just a hip swing. So this we would want to hold on to. So if you're in the court, you'd hold on to the wall, but just swinging your leg. Now it's not like an active kick motion. Okay. It's just going loose with your leg. Just letting it kind of move back and forth. Again, you should feel kind of some warm heat coming in through your buttock and the front of your leg. And then you can do swinging. You can go straight back and forth like we're doing here together. You can go out back and forth this way. Okay, it should feel good. Or you could even do what's called an opener, where you kind of do this. Gets the groin sore. So mainly for our guys, get that groin warmed up. Okay.
Not
So-
just for the guys.
It's girls too. I got one too.
Yeah.
So guys and girls, they stand corrected. Okay, so quick review, swing forward, side to side, or open. And then you'd want to do it on both sides, right? You'd want to get both legs. So a couple of minutes each exercise, because remember, we're doing this about 5 to 10 minutes before play. Okay. All right, the third exercise is trunk twists. So this is going to help with your upper body. I thought this picture was nice for just on the court. You could just even have your racket in your hand, just kind of twist back and forth. And it's okay to pivot on your feet. I don't know if y'all can see my feet, not so great here, but just pivoting back and forth. Again, bringing some kind of flexibility and some heat kind of to that part of our body so we don't hurt our back or strain our back. Also gets the shoulders a little bit more too. Okay. Let's keep moving. Now we're getting into a little bit more of a dynamic movement, like we're going to move a little bit. So first one would be a side shuffle. So that would be slow pace, would just be side to side, working on your footwork. If you feel like you're a little bit more mobile and more able-bodied, you could pick up your pace and go a little bit side to side. Just kind of nice and slow, nothing too wild. Just getting the body ready for play. So that's your side shuffle, okay? Hamstring walk. I call this a monster walk in clinic because it looks like Frankenstein, okay? But it's just kicking that leg straight and
No
walking back and
bend.
forth.
It shows a bend in her leg. No bend or
That's-
bend.
No bend. I
No
would do
bend.
no bend. She's just really trying to hit her toe. I don't know about you, but I can't do that. But just stretching, you should feel this in the back of your thigh.
I do.
Yeah. Anybody feeling it back there? Yeah. So just kind of a monster walk or hamstring walk. Now a little more meat and potatoes. Now we're getting to the agility aspect of the game, right? Little side hops. Or it could just be quick side steps, back and forth. Or if you feel better about it, do little hops back and forth. Okay, so about a minute or 2 just to get you ready. Now, how many? I'm hot. How are you?
Yeah.
Yeah, we're all warm, right? They're all warm. So that's the idea. Warm up our bodies for play. Okay. Good. So we didn't do a full minute or 2 on each one, but you can see it's not that long of a program. It's an easy thing to do. Then you do this, and then maybe you just do some quick walking laps around the court with your pals. Okay. All right. Now more. How do I still stay off the bench, right? We talked about dynamic warm-up, okay? We've done that, we're gonna do that. Now, how do I actually prevent myself from hurting myself? We talked about how weakness in your hips can make you have an injury, not being like stretched out enough, things like that. So generally, we're gonna go through some different stretching and strengthening programs. So I just wrote kind of like how often, how many kind of thing to do here for guidance to get you started. So that this specific things aren't written under each picture, but this is where I would have you start. Okay. So with regards to strength, only 2 to 3 times a week, not consecutive days though. So you can't do it Monday and then do it Tuesday, okay? When it comes to strength training, you need to allow your body to recover between the strength training. So when you do strength, you get little micro tears, right? And then you need a day for those guys to recover. All right, so maybe 2 times a week, 3 times a week, but just non-consecutive days, okay? And about 10 to 15 reps would be a good place to start. With regards to stretching, this is an everyday thing, realistically, okay? You should try to stretch every day. You can hold the stretches between 30 and 60 seconds and do them about 3 times. So do a stretch, do a stretch, do a stretch, do stretch, do stretch, do stretch. Okay. So that's just a basic program for you to give you some guidance into what we're gonna, or how we're gonna move. Now, these are a little bit more challenging because if you're on the court playing pickleball, some of you guys should be able to do some of these things. Now, these are professional picture people. Nobody's gonna look this good. Okay, so that's the first thing to realize. Do not compare yourself to the excellent form and quality of movement that you see on the screen. So your bodies are gonna move a little bit different. So let's first start with the lunging, okay? Now, I'm just gonna show why lunging is on here, right? We play pickleball, boom, boom, boom. See all the movements our legs make? Lunges will help prepare you for some of that, okay? So I'm gonna start with my right leg. I have my hand on a support here. I'm gonna step forward. And then I come back. I step to the side. And then I come back. And then I step behind me. And then I come back. Yeah. So yes, hold on. I feel a little shaky. Hold on. I hold on too. Now, form wise with your lunges, so I'm going to tell you what I tell my patients. You step forward. You're not lunging like this. Your knee shouldn't go over your toe. You're an elevator. Down and up. That's a lunge. Okay. To the side, same thing. You're an elevator. You're going down. You're coming up. And then back. Going down. Going up. Now, if you have some issues with knee pain, expectation is not to get down like these fabulous photo people. Okay, it's just to get that muscle going a little bit. So use pain as your guide. Don't push into pain. That's not going to get you anywhere. Okay. So lunges, that's a challenge. That's a challenge. We won't do this together because I don't want anybody to have to get on the floor. But this is what's called a hamstring bridge. Okay, we talked about how a lot of times people will like pull their hammies kind of a thing. So this is a basic bridge where most of you may have done it, where you just lay on your back, your knees are bent, you lift your butt up. Most of us maybe have done that. You use it a lot just to move in bed. So even if you didn't know you were doing it, you're probably doing it. The difference, as an exercise, you put your toe, pull your toes up. So you're pushing through your heels when you lift your butt up. That's going to isolate the exercise a little bit more on your backside and both your bottom and your back of your legs. If you want to try it, you're welcome to give it a go, or you can try it another time. But you would do this up and down, up and down. Now, if you are weak in your hammies, you might do one. If you try to hold it too long, guess what? You're probably going to get a cramp. So don't just go for it. Just go up and down to start, just to kind of get those guys moving. Because a lot of people will get cramps if they hold that one too long. So it's just up and down. But being on the heels is going to isolate the back of you a little bit better. Okay. Calf raises. We should have told Aaron to do these more. No, I'm kidding. Up and down on your tippy toes. Okay. Up and down on your tippy toes. Working the backs of your legs and getting a little bit stronger in your calves. Okay. So up and down. Now, if you're like, Emily, I do that one every day. That's a breeze. Great. Go to single leg then. Okay. So if you can do, and you've been doing doubles forever, guess what? It's time to upgrade. Single leg. Okay. So up and down, getting your calves nice and strong. This will also help your game, guys. It's going to, that's the muscle that propels you to get around.
How about being on a step and going
Sure can do that.
past horizontal?
Yeah. So question is, can I do it off the edge of the step? Even better. Even better. So this would be if I can just knock them out in the grocery store, right? I'm waiting in line. But if you have time, you want to just sit and do this program every day, which would be what I'd recommend. Yeah, you can hang off the edge of the chair of the steps at your house and push up. That works through a little bit more range of motion. So it's a great way to progress it too. Okay, so far we got our lunges, which is actually 3, our hammy bridge, and then our heel raise, okay? All right, so now I have a couple more strengthening exercises that do ask you to have a band, okay? Is it the end of the world if you don't and you're gonna toss it in? Nope, I'm not ever exercising, I don't have this band. No, you can do it without, okay? So you can get bands. Some of you who've maybe been to therapy before might have some. If they're very old, they could be brittle. So I would caution against using them if you've had them for a few years. But you can buy them at like Walmart, Marshalls, TJ Maxx, Target, and get some bands. So the first exercise I'm going to show you is the side step. So we talked already about how the rapid movements, right, side to side, and we have hip weakness that can impact everything down. So this is to really work on your hip strength. So what I do is I'm going to take a band, and if you're a little off balance, you would do this in sitting. Put it around your ankles. Right in the hallway or along the countertop like the gal in the picture, I do side steps. And then remember how many? 10 to 15, 10 to 15, okay? Back and forth, back and forth. Now, a lot of times people will do, you kind of want to start in that sports stance, just like when you're playing, right? A lot of times people will start and then all of a sudden here they are. You don't stand like this and play, I don't think, right? So you got to make sure you correct yourself. When I do these at my house, I have a mirror kind of right behind the back of my couch. And I was saying, oh, there I am. I'm too light. You know, I work, oh yeah, I get down there. I can see me. Oh, there I can see me again. Got to correct it. So just make corrections. If you put it around your ankles, and you're like, holy smokes, that's too hard. Take it and put it right above your knees. Work into it. Okay. If this is too hard, go without a band. It's great practice for movement. Okay. All right. There's our band. Now we also have some shoulder strengthening. Kelly, can I borrow you for a second? So what I have here, this would just go on a door at home. Am I your door? You're my door. I'm going to hold the band, pull my arm away from my belly. Okay. And then pull to my belly. I didn't want to turn my back to you, but pull to my belly. Okay. So out to the side or to my belly. So just for some general strengthening, great if you're kind of rehabbing a little bit of a shoulder injury already. Okay. Again, pain-free, right? You're here to keep playing, not to hurt. So pain is your guide. Now, the last one may seem like a weird one to have with a pickleball injury talk. Dun, dun, dun. Balance. Got a lot of head nods in this room, hopefully online too. So balance is huge because if you're not steady, right, on your feet, we talked about, right, the risk fractures for women, falling, getting a bruise on your butt, you know, all those kind of things. And just feeling more confident, okay? So what I put here is a series for you all to try. Some of you are gonna knock it out of the park and get to start here. Some of you will have to start here or here and work towards it, okay? And that's okay, at least you're starting. So the first position is essentially one foot in front of the other, okay? Now, if that's too hard, do it at the counter, just like I am. And some of us in our class are doing it, just holding the wall, okay? Now, when you're standing like this, you want to feel your weight equally distributed from the front and the back leg, okay? And you're gonna try to stand and maybe stand there for like 30 seconds to a minute, okay? If you lose your balance, you just touch and regain, okay? And then guess what? You gotta switch feet. Now, it's not unusual for you to feel one way is easier than the other. All right, and that could be that you have a little imbalance with strength. So we'd start the same way. Find that point where equal weight, front and back. Take my hand away, try to hold it, set my finger down when I need it, go back. Okay. Now, we nailed this. We're getting to 30 or 60 seconds, no problemo. We go to our next step, which is single leg stance. But it'd be at a countertop. So you would start with hand, one leg, and just see if you can stand there. One, you might be surprised. It's pretty tough. And then maybe that gets easier. So you take your hand away and then it's like 10 seconds in, you're like, woo, you touch. Okay, but we don't put our foot down. So we're here, Here, 20 seconds, woo, touch, okay? The goal then ultimately is to get solo. Just be able to stand with no help. Harder than it looks, harder than it looks. The nice thing with this program, this part of the program is one, it will help your balance for sure, but it's also gonna feel like you're getting stronger. I don't know, for those of you that are on your leg, one leg, can you feel it in your butt? I can, right? Because that's what you're working to stabilize. Also great for your core. Okay, so this is a huge little picture, but a big part of success in pickleball. Okay, all right. Now we're getting to static stretches. So just quick review. Remember, dynamic stretches, movement that mimics our play. We do it for about 5 to 10 minutes before we hit the court. We're done with play. Now we do some stretching as we cool down. Okay, so elbow, wrist issues. Here we go. We're going to pull that hand straight back. We'll feel that in the bottom. You would hold that for, anybody remember how many seconds?
5 to
30 to 60 seconds. How many times? 3, somebody? Yes, 3 times. Yeah. And then we would reverse our wrist. This you're going to feel more. So this one is going to get the outside of your elbow a little bit more. Same thing, 30 to 60 seconds, 3 times, right? Okay. Now we have our calf stretch to help prevent that calf pain. Our basic runner stretch. We put one leg back, one leg forward, and lean forward, feeling the stretch in our calf and the back leg. Heel is down. Kind of circling back with doing stretches or the up and down on the steps for heel raises. You could also hang on the steps at home too. But this would be something you might want to do before you jump back in the car to head home. Okay, you can just do it right along the court, like along the fence line. And you would, of course, do this on both sides too.
If it was feeling great and you're like, I'm gonna hold it for 2 minutes, is it just a waste of time? Or damage it?
No, it's not going to damage it or anything, but you might not get a lot of change in muscle tissue at that point. Yeah, yeah. So calf stretching. Now this is a double one. Hammy and inside thigh. So hamstring, there's a lot of different ways to stretch the hamstring. Just to preface this is just one way I thought, well, if we do stuff in standing, you'll do it at the court, right? So for the hamstring stretch, I'm going to do it on my right leg. I kick my heel up, my knee is straight, and I kind of lean down. You're going to feel that in the back of your thigh. If you do not, it's because you're bending and stretching your back. Keep your head up. Chat with your friends. Stretch together. Okay. How long? 30 to 60 seconds, right? Good. And we would do both legs, of course, on this as well. Okay. That one should feel good. We shouldn't push into pain when we stretch. Should be mildly uncomfortable, but not painful. So pull your toe back. Al, pull your toe back, bend that right knee. There you go. You got it. And then the other one is the groin, so our inner thigh. So that would be getting that good stretch in the thigh. Okay. Just feeling that there. 30 to 60 seconds. You guys are going to be dreaming 30 to 60 all night now. And then we would do the other side by switching. Now, again, it's not abnormal to be like, holy smokes, that's really tight. No problem here. That's not abnormal. Okay. Again, you might have some different imbalances in your body. And this is a good way to kind of address everything. So this is our cool down. After play, we stretch a little bit. Okay. Let our heart rates come down naturally. Okay. All right. Now, this one's a fun one. This one I included for you hardcore, die hard, win with no costs pickleball players. We got a couple in the room. So these are just some fun exercises I thought I'd include to just see if you wanted to try to work on your eye-hand coordination. So if you're one of those people that swings and strikes out a lot, for example, this might be something you can play around with a little bit. And so this would be sequential, meaning if you can't do this, you shouldn't be doing this, okay? So this first one is straight up just holding your pickleball racket. And I have this as you have to disregard the thing on here. Just got my pickleball racket. I have a ball. And I just work on batting it, right, and catching it, and that, which I didn't do, okay? So that would be this one, so bounce on the paddle on a large surface. Then the challenge would be on the corner. There he goes, okay? So trying to do that, okay? Now, the fun thing with this, let's say you have nailed the balance work. And you're looking to kind of update or upgrade, you go maybe into your one foot in front of the other. Or you go into single leg. Okay, so for some of you higher, more competitive players, there's ways you can make this up to your level. Okay. Now the next one is one you do on your own. I'm not going to do it just so I can look at y'all, but you're going to essentially throw, just like the picture, you're going to throw the ball to yourself with your eyes closed and then open it and try to catch it. So you close it, open, close, open. Okay. Just to work on that, the eye-hand coordination. Obviously this is too easy. You get some air in there to challenge yourself a little bit more. And then this would be something that if you feel like you can do a lot of these things, great for partner play. You can do this together. So you have a partner, they're in front of me. I close my eyes, partner says, okay, and throws it and you open it and try to catch it before you drop it, right? Trying to catch it. So you open your eyes and catch it before it hits you. Nice thing, these are nice and light. So these are just like a little extra hand-eye coordination, would be useful in pickleball or other sports like tennis or ping pong even, okay? Just to work on that quick motion and quick kind of response, all right? So there's a big program. Now, if you are already currently suffering from an injury, it may be in your best interest. You guys can sit down if you'd like. You can sit down at home too if you've been up on your feet with us. It may be in your best interest to actually come into PT or OT and have someone look at it just to make sure you're doing the right thing for what your body needs. Okay, so this is kind of a basic general program, but again, if you're already having issues, come and get checked out. You can just contact your primary care provider, your doctor, and see if they'll write you an order. Sometimes it's as easy as if you're a MyChart person, you can just write a MyChart request and it's so busy for them nowadays, they might just give you that order to come and see us. If you do not have Medicare insurance, so maybe your insurance is just Dean or Quartz or something like that, you can utilize therapy services through a program called Direct Access, meaning you don't even need an order. You just call us and make an appointment. That's it. So if you're Medicare age, you still need an order from a doctor. Or you have Medicare. If you don't have Medicare but have another insurer, you can just access therapy services by just a phone call. Obviously, you can go anywhere. If you want to stick with us here at Stoughton Health, we have a Stoughton clinic, there's a number, and an Oregon clinic as well for both PT and OT services. Okay. So OTs generally might see your elbow or your wrist, where PTs could see some other stuff too. Okay. And that's it. You guys all cured? No? Okay. So let's open a little, I know we've been kind of asking a little bit of questions as we've gone. So if anybody has any more questions or if you had any coming through chat.
There's one comment in the chat. For those who don't already wear glasses, I highly recommend wearing safety glasses.
Yeah, yeah. That's a great question. Yeah. That would be a great, just to protect your eyes. Any other questions from chat?
How to prevent TENN?
Tendon?
We need more of our.
Maybe tendinitis, maybe. So I'm not sure what TENN is referring to, but if it's referring to tendinitis, that would be from doing some of the activities that we just talked about. Now, if you already got tendinitis, that's a little different. So tendinitis might take that visit to PT or OT, ice, rest, reducing inflammation.
Tennis elbow.
Tennis elbow. So tennis elbow is epicondylitis. So we got that very good stretch that we talked about. That's probably one of the better ones for tennis elbow. Usually with tennis elbow, again, disregard this, it's just a clinic thing. Usually with tennis elbow, it could be because you're either your racket's not a good fit for you or you're gripping the heck out of it when you're playing. So you might have to look actually at your physical racket and what you're doing with it. Okay. So, if that's something you're like, well, how the heck do I do that? Great question. So remember at the beginning, we did the trunk rotation one, kind of just as a dynamic warm up. Maybe start doing it with your racket where you're holding it nice and light and you're just moving. Move it nice and slow side to side, just to help with your grip, getting used to that, a slighter grip while holding your racket and moving. That might be a place to start. But if it's unfortunately already a tendonitis, overuse is gonna not be a friend, right? Overuse injuries essentially is gonna be what causes most tendon issues with pickleball play. So you can try stretching, you can try looking at your grip, and if it still seems to be a problem, then you might need to come in and see us in therapy.
What's the proper grip size?
I don't know. I don't have the stats on that. I think you have to look to see. So I have what I call man hands. So this is a good size for me, but she's pretty petite. This would probably be a really big grip for you. Yeah. So I think you just want to make sure your whole hand fits around it. But I don't want my hands to like fake it, like overlap on it. Yeah.
I think Barb makes a good point because she asked it both ways, how to prevent tennis elbow and how to treat tennis elbow. So I think all of this is prevention, but once it happens.
Once it happens, your probably best bet would be to come into therapy. Yeah. Because we still want to keep you on the court, right? We want to still keep you playing, and you just might need a little bit more specifics, but in therapy, you know, we have different tools like dry needling, A-stem, more manual based therapies, a lot of different taping even that can really help with tendon issues. So it might be a thing that you can go, and then with PT or OT guidance, help kind of work together with that return to play at your level that you're normally doing. But it is a common issue. There's even some bracing. I think the research lately is about the bracing for tennis elbow, so I wouldn't jump on that right away. But those are great questions. Anything from you coming in still? That's it. You all have any questions? Everybody warmed up? Yeah, me too. Me too. So again, thanks for your time. Thanks for your time online too. You have my contact information. Please don't be embarrassed or shy. Just call me or message me. Let me know maybe, hey, I was listening to this talk. I want to learn more about this or this. If I don't think I can help you via email or a phone call, I might say, hey, why don't you come in and see us? You know, and we have a great staff here through Stoughton Health. They've been People's Choice Awards. They're really stellar for being a small community-based hospital. They're in good hands with whoever you come across to see. Okay. All right. Thank you guys. Enjoy the rest of your day.